Does pandas exist? Well, today we're going to be exploring this very interesting clinical question and answering it the way we should answer all clinical questions by looking at the published medical literature from peer-reviewed journals and also coupling that with the clinical experience of practicing physicians throughout the country. So, of course, pandas has been coming more to the forefront in the last few years, and you may have seen information about it on social media, or you may have been seen it in the actual media. But at the same time, you've likely seen that it is a rather controversial topic. In fact, it's so controversial that in one of the neighboring states to Indiana, where I practice, um, physicians are not really allowed to mention the concept of pandas anywhere in the hospital system. It's, in my opinion, a bit of academic bullying. But I don't really think that's necessary. I think that what's important is to look at the published evidence in light of clinical experience of practicing physicians and really figure this out. So, in the early 90s, 1994, I believe it was, Dr. Sue Sweeto from the National Institute of Mental Health and her colleagues began studying a group of children who developed severe sudden onset anxiety, OCD, and tics, facial tics, motor tics, after having strep infections. What they soon discovered was these children had antibodies to a protein in their brain called tubulin. And what's interesting is that there was some cross reactivity or some molecular similarity between this tubulin protein in the brain and the outer coating of the strep bacteria. So it was a case of what we call molecular mimicry in medicine. And it's actually a common cause of autoimmune diseases. So they postulated that there was somehow a connection between strep and this neuropsychiatric syndrome they were seeing. They termed it pediatric autoimmune neuropsychiatric disorder associated with strep infection. What they soon discovered was that by treating the strep, many of these children began returning back to normal. In more difficult cases, they actually discovered that using intravenous immunoglobulin conferred a benefit. And this was back as far as initially it was studied, I believe, in the Lancet in 1999. So they subsequently conducted, other researchers conducted MRI and PET scan studies and found changes in the brain in children with pandas that were very similar to the changes that were seen in Sydenham chorea. Now, Sydenham chorea is a movement disorder which comes with acute rheumatic fever. Acute rheumatic fever is an autoimmune condition that can occur sometime after a strep infection. And so it was interesting, there was this link between these two autoimmune conditions. Ultimately, they published their literature, and the mainstream medical community kind of went with that, and more people began to learn about pandas throughout the 90s. Now, later, in I think 2013 to 2017, there was additional research done because children were also having very similar presentations with OCD, anxiety, aggression, defiant behavior, etc., after other infections, things like mycoplasma or Epstein-Barr or influenza. And so researchers then, Dr. Sweeto and her colleagues, published some additional information and came up with this term PANS, Pediatric Acute Onset Neuropsychiatric Syndrome. So that encompassed PANDAS from strep, as well as similar presentations from other infections. Now, if you look at that, this may be where things started becoming controversial because people looked at it and said, well, we understand from strep, but these other infections, what's the story there? Well, there have actually been multiple studies. In fact, children with Tourette syndrome who have both motor and vocal tics actually have higher degree of antibodies to mycoplasma, meaning mycoplasma may have some link here. And in fact, mycoplasma infection, when it turns into encephalitis, that's kind of more serious of a presentation of mycoplasma, which is just a respiratory infection. But those children actually have an attack or involvement of the basal ganglia, a portion of the brain which is also involved in pandas. And so throughout the years, additional supporting studies were done. Additional studies have been done on IVIG, and IVIG has been shown very effective in cases of pandas. So I've been practicing medicine for over 30 years, about 32 years at the time that this is being recorded. I've seen over 60,000 patients. In the last 13 years, I've been treating children with PANS and PANDAS. And I can tell you that IVIG is a very effective thing in a great number of these patients, not all, but a great number. So additional studies have been done showing that other infections like Epstein-Barr virus or influenza all can produce neuropsychiatric syndrome. So that's well established in the literature. People sometimes, I think, also it's controversial to look at pandas because people say, well, it kind of was invented in the early 1990s and why didn't anything happen? But actually, if you look back as far as the mid 1920s, you will find reports after the Great Flu, the influenza in 1918. There were people who developed a specific type of encephalitis called encephalitis lethargica. It was first described by Dr. Konstantin von Economo. And what's interesting about that is there were similar reports at that time of children who were affected by this and had a very similar presentation to pandas. I think it's likely that over the years we may have missed this, and I think maybe the chief reason why PANS and PANDAS are so controversial is because it forces you to look at what we call mental illness, whether it's anxiety or OCD, in an entirely different way, and say, hey, maybe this is not just hereditary or mood driven or event driven, but there's a subproportion of patients with these symptoms from an infectious insult or an autoimmune attack on the brain. So if we look at it and we say, okay, so there's a good amount of published evidence, that's the first type of evidence we would look at from peer-reviewed medical journals. What about the clinical experience of physicians practicing in the community? Well, I can tell you that there are multiple academic medical centers around the country who have neuropsychiatric units that focus on treating children with PANS and PANDAS, and those include Stanford, also Massachusetts General Hospital, Dartmouth, University of Wisconsin, University of South Florida, also Johns Hopkins. So all of these hospitals treat children with PANS and PANDAS, and they use IVIG and antibiotics and steroids and other things. And so this is something that's done at large academic centers. Then if you lump into that the experience of community physicians as well as myself, I've treated several hundred children with this disorder over the years. I can assure you that this is a real disorder, a real thing. These children, when they're tested and treated correctly based upon that testing, they get better in the vast majority of cases. And so PANDAS is something that, obviously as a physician, you're trying to figure things out. And when you hear something's controversial, it's kind of hard to accept. And we all worry as physicians about being in the academic space and talking to people and having them kind of look at you funny when you start talking about a subject like pandas. But what I can tell you is if we look back through the history of medicine, we haven't done very well at times with things that were rather controversial, but it ended up being true, right? We can go back to 1850 with Ignaz Semmelweis, who actually had the audacity to suggest we should wash our hands between patients. And his discovery that hand washing can decrease infection in women who'd just delivered children was revolutionary, although at the time he was called an embarrassment, and people said he was crazy. Then if we fast forward to 1929, Werner Forssmann suggested that we may be able to use a catheter and insert it into coronary arteries and study coronary arteries or open them up and do cardiac catheterization. And of course, he was, I think, kicked out of the hospital he was practicing in at the time. And now cardiac catheterization is the standard of care when people have an acute event or when they're having symptoms related to cardiovascular disease. And then even go more recently to 1982, when Dr. Barry Marshall and his partner suggested that Helicobacter pylori, H. pylori, this bacteria was a cause of ulcers and gastritis in the stomach. And of course, people said that is absolutely impossible. No bacteria could exist in the acidic environment of the stomach. And sure enough, it ended up being true. And now we test and treat people for H. pylori and helps them heal from gastritis and from ulcers. So, um, where can you get more information? Because that's the question I'd be asking. It's easy for me to sit here and quote studies and give you results, but I understand if, as a physician as well, you want important, credible information. So I've written a book called The Comprehensive Physician's Guide to the Management of PANS and PANDAS. It's a textbook directed at physicians and other clinicians who take care of these children. It contains over 1,200 references from the peer-reviewed medical literature. And so you can get that if you go to my website, www.thepandasdocs.com. You'll find it there for lower than you would find it on Amazon, and we can ship that out to you. Also, on that website, you will find multiple blogs about PANS and PANDAS, which contain additional references and additional information about how we treat that. I would also encourage anyone here who takes care of these children to go to the PANDAS Physicians Network site. There are some initial treatment algorithms to get you started there to give you an idea of what to do. And if there are any parents watching this video, I hope it's proven edifying for you and supports what you know to be true, that PANDAS exists. And I hope to give you a bit of hope for that. So please take this video link, and if you need to send it to someone, if you need to send it to a physician or someone else, that may have, or a family member that's been a little bit skeptical about what's going on with your child, certainly please do that, because we really do need to increase awareness about PANS and PANDAS. Thank you very much. Have a great day.